All right, today we are going to go over HMO versus PPO. Sounds so exciting, but I promise I will make it as interesting as possible. I have explained this hundreds, if not thousands of times, definitely probably thousands of times. I have been doing insurance for over 20 years now. I know how to break this down into layman's, clear English, clear speak. There are some insurancy terms, but I will break it down 100%. And this is not going to be your typical HMO PPO video. You are going to learn something different that you've probably never heard before. It is important for you to know these concepts and know how these different plans work. Knowing how these different plans work will reduce frustration when you actually go and use your plan. You will understand why there are certain rules about your plan. You will understand how to maneuver through the system. You'll understand which plan is going to work best for you. Okay? This video is not to tell you an HMO is bad or a PPO is bad or an HMO is better, PPO is better. I'm not going to sell you a product. It's all about my opinion and my experience, and here to educate you on exactly what is important when looking at an HMO versus a PPO. All right, so let's go ahead and dive in. Okay, so here's my presentation, HMO versus PPO. And we're going to do some housekeeping, like I mentioned before, where we go over the definitions. What you will see when you Google it, what you're going to see on healthcare.gov, and then we'll dive into some more details. So just for context, an HMO stands for Health Maintenance Organization, and it's a type of insurance that typically limits coverage to in-network only and will not cover out of network. An HMO may require you to live or work in a specific service area to be eligible for coverage. Members must select a primary care physician or PCP who coordinates all their health care and provides referrals to specialists when needed. Key features of an HMO: requires in-network care except for emergencies, lower premiums and out-of-pocket costs, emphasis on preventative care and coordinated services. Yes, HMOs will coordinate services for you and cover your preventive care. What is a PPO? Again, just getting through the general definition, then I'm going to dive more into the nitty-gritty here. And be sure to hang out until the end, because there are some specific details that you certainly are most likely not aware of. And I promise it's not a sales pitch, although there is a little bit of a sales pitch, which goes like this. If you are an employer and you're looking for benefits, or you want to evaluate your current benefits plan to see if it's suitable for today's environment, please click the link down below. Schedule a free meeting with me. I will do a free evaluation for you. And that's it. That's my sales pitch. It's super short, so not too painful. So what is a PPO? PPO stands for Preferred Provider Organization. A PPO is a health insurance plan that offers flexibility, allowing members to go both in and out of network. Members are not required to choose a primary care physician or get referrals to go to a specialist. Key features of a PPO: flexibility to see any provider, higher premiums and out-of-pocket costs, coverage for out-of-network care, although costs may be higher. And we're going to get into exactly what that really mostly looks like. So it's important to keep in mind, so before we go forward, if you are looking to choose a plan right now, you want to check these three things and keep these three things in mind. And I always keep these three things in mind when I'm talking to employers. Healthcare that meets your needs. Is your doctor on your plan? Is it in the network? It may be they don't accept the HMO, so then you just look at PPOs, and it really helps you narrow things down. Manage costs. What can you afford? We don't want to break the bank. We don't want to go out of business. We don't want to go into bankruptcy over paying our insurance premiums. Everybody loves a PPO with a $0 deductible and low copays, but can we afford it? So really understanding the costs that are surrounded by the monthlies on the premiums for healthcare, and maximizing your benefits. looking at the portions of the plan that you know absolutely you're going to use. Look at your usage from last year. Look at, do you have a upcoming surgery? That really will help you narrow things down. Are you pregnant? Are you planning to get pregnant? If so, you're going to want to look at the hospitalization and the prenatal benefits. Another key factor is look at the prescriptions. Perhaps you're healthy every other way and you don't go to the doctor much, but you have specific medications that you absolutely need every month. Check the formulary. And we're going to get more into that here later in the presentation, so I don't want to get ahead of myself. So diving deeper into what an HMO is actually. Now, quick disclaimer, I'm not your insurance agent. I don't know exactly which plan you have or what you're on. This is not meant to be advice to get you to go on one plan or another. This is talking in generalities, so please keep all of that in mind moving forward. This is just my opinion based off of my experience, and please take it as such. It is not advice. So in traditional HMOs, an insurance company gives all of the responsibility for day-to-day administration and member care to the medical group or IPA. Side note, future slide, we will go over what exactly a medical group is and an IPA is and what the differences are. But for now, what basically a medical group or IPA does is they offer a service to the insurance company. They say, hey, Mr. Insurance Company, we will take on all of these headaches from all these members that you're filing claims for every day and doing pre-authorizations for every day. Don't worry about any of that. We will take that on. So at that point, the only thing the insurance company is involved in are claims surrounding hospitalizations. Okay, so for this service that the medical group is providing to the insurance company pays them for their service. And that is called a capitated rate. So here it says capitation model. Insurance companies pay the PCP or medical group or IPA a capitated rate, a fixed monthly amount for their members. So when you're filling out your paperwork or online or on paper, and it asks you for your PCP number, that is to give money to that primary care physician or that medical group every month to sign you up with them. And again, the insurance company is basically hands off from that point. So the capitated rate covers the most common services. We're going through our checklist. Second item on the checklist is the primary care physician or medical group assumes responsibility for management of the members and healthcare needs associated with administrative tasks. Number 3 is insurance company is primarily hands off for most claims. The insurance company steps in to process claims for hospitalizations and major surgeries or out-of-network emergencies. Okay, and we'll talk about that more in a moment. Administrative management, the medical group or IPA handles claims, referrals, and other administrative responsibilities. All right, so that is the major difference between an HMO and a PPO. And the reason why we have all of these different types is people are trying to design plans to manage these healthcare costs. If you're like most Americans, your health insurance costs have gone up year over year, and your health insurance costs have gone up year over year, and same for employers. So there's all these different types of plans to try to manage the costs, and the HMO is one of those ways. And way back when they started HMOs, the idea was, hey, the insurance company is going to manage the major risk, and the HMO, the medical group, is going to manage the day-to-day. And it's a great deal for the insurance company because they get to be hands-off and only worry about emergencies and hospitalizations. And it's a great deal for the medical group because they get a fixed monthly income for their members. And the better job they do managing members, the more members they get. In theory, it doesn't necessarily mean that it always happens that way. But one point I do want to bring up is that when choosing an HMO, it is just as important, when you're going through and choosing your plan and you're choosing which insurance carrier to use, it's just as important to choose the right medical group or IPA and primary care physician. They have so much control over what your experience is going to be within that HMO. So sometimes when people say they absolutely hate HMOs and are never doing it again, it may not just be the HMO's fault or the insurance company's fault. It may be due to a bad experience with a bad medical group. I don't want to say bad, but you know what I mean, loosely speaking. Okay, so in a PPO, PPO stands for Preferred Provider Organization. You have the freedom to choose a provider. You can go in or out of network. You may have access, or you do have access to in-network provider lists at lower cost, but you may go out of network. So I'm going to go over this in more detail in the next slide, but I will say this now, most PPOs don't really have much coverage out of network. They might as well not have any out of network coverage. Out of network reality, going out of network often feels like having no coverage at all due to out-of-pocket costs. Higher deductibles, out-of-network deductibles are typically much higher than in-network deductibles. If you're one of the lucky ones, you may have a combined in and out-of-network deductible, but typically most plans are designed to minimize coverage significantly for out-of-network providers, and we'll go over that in more detail. Cost sharing is limited. Coinsurance is often much lower at 50% of allowable costs, and we'll go through some examples. So understanding MAC and UCR. So you'll see this a lot on dental plans. It's not as descriptive usually and not laid out so clearly on medical plans, but it does exist within medical plans as well. So you've got MAC and you've got usual, customary, and reasonable. And the big difference is that MAC is based off of a fee schedule, usually based off of a percentage of what Medicare pays. So a lot of our healthcare system, particularly within hospitalization care, is based off of Medicare reimbursement rates. So every single procedure code, every single procedure out there has a code. And I like to use dental as an example. It doesn't really translate to Medicare, but for example, with dental, each and all the different names for all the different teeth, right? So think of all the different teeth, all the different sides. Then you get into, is it composite? Is it amalgam? Is that silver filling? Is it the white filling that matches the color of your teeth? These are all different. Every single one of those is a different procedure code. And it's even more procedure codes with medical, right? Because the dental is just for our mouth. I mean, think about our entire body. So with all that said, each and every one of those codes, there's a reimbursement rate listed by Medicare. And a lot of hospitals take that and they say, okay, if we have this Medicare reimbursement rate and this is how much of our population, they look at the population of their consumer base and they say this percentage are Medicare patients, this percentage are private health care. So this private healthcare sector, in order for us to be profitable and keep our doors open, we have to charge 200% of what Medicare reimburses us, right? Because we're losing money on the Medicare folks. So we're going to make it up with the private health, and they base it off of percentage of what Medicare reimburses, and it's usually higher than what Medicare reimburses, okay? So maximum allowable charge is a fee schedule, a predetermined fee schedule, sometimes based off of Medicare, sometimes not, that the insurance company will reimburse based off of that fee schedule. And then you have the usual, customary, and reasonable, which is a percentage of what most doctors charge in your area. And it can be a different percentile. So a typical percentile might be 80%. So if you go and get a cleaning and you're in Beverly Hills, your percentile for reimbursement, or the amount that you're going to get reimbursed for cleaning, is going to be a lot higher than maybe Big Bear or something like that, so a more rural area. Rates, insurance companies determine a set of rate for each service based off of local averages or negotiated costs for in-network providers. So keep in mind, I know it's frustrating when you go out of network and get reimbursed a very low amount, or you get a very low amount of benefit, usually around 20% when you thought it was going to be 50%, or maybe even 10%. But you have to remember that these insurance companies are contracting with in-network physicians. So, for example, with this scenario here, a member sees an out-of-network doctor and is charged $1,000. The insurance company determines that the UCR was $500. So, what they would pay their in-network doctors may be $500 or $600. But they cannot reimburse out-of-network doctors more than what they pay their in-network doctors. Otherwise, no one would contract with insurance companies at all. So in this example, the members billed $1,000. The insurance company determines that $500 of that is usual, customary, and reasonable. And the plan pays at 50%, let's say, out of network. So 50% of $500 is $250. So the insurance company, of that $1,000 bill, they're going to pay $250 of that, assuming that you don't have an additional deductible, which you probably do. And likewise with a deductible, let's say you do have a $1,000 deductible. In this example, even though your bill is $1,000, only that $500 is going to be credited towards your deductible. Only the usual, customary, and reasonable charges will go towards your deductible, not the amount that you're billed. So again, out of network is not much of a benefit at all in today's environment. I see where oftentimes we'll have in-network deductibles maybe at $1,000 and out of network might be $10,000 on that plan. So a lot of these PPOs are designed like EPOs. And EPO, it's a newer type of, it's newer than PPO, and it's newer than HMO. It's not new, but it's probably new to you, the concept of an EPO. An EPO looks, acts, and feels just like a PPO, but it has zero out-of-network coverage. Okay, so you can still, you don't need referrals, you don't need a PCP, you can still self-refer, and you have to stay in the network. And if you go out of network, there's no coverage at all. But at this point, with the way plans are, you might as well just have an EPO because so many of these plans hardly cover anything out of network anymore. So what is a medical group? A medical group is an organization of healthcare providers, often in multiple specialties, that all band together and they operate as a single entity. Medical groups are typically larger and more centralized than IPAs, and we'll go over IPAs here in a moment, and have a centralized billing and approval process and claims team. Key features of a medical group: integrated providers. A lot of times you'll see one big building for the medical group, and that big building will have all different types of specialists within there. They have in-house specialists, and they employ their doctors. They're not independent doctors. The doctors work for the medical group and probably get a W-2. Now with an IPA, it's very similar to a medical group, and you probably won't notice the difference as a consumer. The only big difference you may notice is that there's no one big building with all of these specialists in one area. You may go to one side of town for your primary care and clear over to the other side of town for your specialist. For the most part, the IPA stands for Independent Healthcare Providers, and it's exactly that. It's a band of all independent little businesses that band together for negotiating power with the insurance company, and they refer within that IPA together and look like a medical group. So when you are choosing a HMO, most of the time you have the option of choosing a medical group, and sometimes you may have an IPA as well in your area, and you may just be wondering what the differences are. Not too many big differences, and here is a visual for those visual learners. So the structure is the IPA, the network of doctors are independent. They're all little independent businesses banding together for negotiating power and to form a pseudo medical group. And a medical group is a centralized organization of all providers. Provider independence is within the IPA and not so much with the medical group. The medical group, those doctors are employees of the medical group. An administrative role are basically the same. So they handle all the claims and referrals, and with the IPA, and for the medical group, it's all fully integrated into one system, and usually is two with the IPAs. Size, it can include a large number of independent offices under the IPA column, and under the medical group column, there's often less buildings and more consolidated, centralized locations. So when we say that HMOs are less expensive than PPOs, what does that really mean? Okay, so it all is relative, right? Here are some general overall average numbers from healthcare.gov. Healthcare.gov is where you go to enroll in individual health plans and get a subsidy from your local, state, or the federal government. And it's based off of age, so there's a different rate for every single age. So it goes 21, 22, 23, 24, 25, 26, 27, all the way through like 80. It goes from like 14 to like 80. So it's a huge, huge rate sheet for each and every plan. And we're not going to go through every rate. I just picked some general ages here for decades. Average monthly cost for an HMO on a monthly basis is $374. The average cost for a PPO on a monthly basis is $451 for someone who is 21 years old. For a 27-year-old, it's $394 for an HMO monthly, and for a PPO, it is $473 monthly. 30-year-old, $427 monthly for a HMO, $512 monthly for a PPO. 40, the average cost is $480 for an HMO, $576 for a PPO. Age 50, it jumps up to $671 on average for a HMO, $805 for a PPO monthly, and 60 jumps up all the way past $1,000 per month for $1,017 on average monthly for an HMO, and $1,224 monthly for a PPO. So those were individual plans. And so next we're going to go over what typically group plans are. Now keep in mind, these benchmark numbers can be extracted per state, and these are, and even per county, and dives down into industries. It can be different for a tech company than a manufacturer, and there's all different sorts of benchmarking data, and I have benchmarking data for people who are interested that can message me directly with the link below. However, for a national average, these are national averages. So for individual coverage or employee-only coverage for an HMO, the average cost in the United States is $663 a month. For a PPO, $674 per month. So the average for a family per month is $1,862 for an HMO, and for a PPO for a family monthly, the average in the United States through an employer plan is $1,943 per month. Annually, that tracks out to be $7,958 for an HMO annually. For employee only, for a PPO, it's $8,092 annually. For family coverage through an employer, on an HMO annually is $22,342. For a PPO, it is $23,312. So keep in mind, these are total monthly billed numbers and annual numbers. This is not the employee cost or the employer cost. So this is the combined employee and employer contribution. These are pure billed rates. Again, in benchmarking, we can get more specific as to what is the average employer paying, what is the average employee paying per industry, are you competitive in your industry, all that fun stuff. This is just general total monthly build, total annual build of the premium for employers nationally in the United States. So for those of you who are more visual, here is a chart to talk about what are the core differences between HMO and PPO. The costs of HMOs are usually less expensive. PPOs are usually more expensive. Availability. There are more HMOs available on the ACA Affordable Care Act, Obamacare, healthcare.gov website, available for subsidies. On the PPOs are more common for employer plans. Out-of-network care. Do HMOs have out-of-network care? No, they do not. Do PPOs? Yes. It is limited in today's environment, but yes, technically yes. Do we need a primary care physician for an HMO? Yes, absolutely. If you do not choose one when you enroll, you will be automatically assigned one. Now keep in mind, if you are automatically assigned one, or you chose a primary care physician when you first signed up and you decide you go and you didn't like the guy, or you didn't like it for whatever reason, or your physician moved to another IPA or another medical group, you can change your primary care physician at any time during the year. Just keep in mind that it will be in effect first the month following the date that you selected. Usually if you do it before like the 15th or the 20th of the month. So for example, if you call your insurance company and you say, I hate my primary care physician, I want to change it, and it's January 15th, it won't be effective until February 1st. They can't do it in the middle of the month because of that capitated rate. Again, it is important to understand how all of these plans work, because you will be less frustrated when you're working through the system. You'll understand, oh, okay, there's a capitated rate, they're paying monthly, so they need to kind of know ahead of time so they can pay the right provider, right? That's very important. So it helps you understand why things work the way they do. So do you need a primary care physician for an HMO? Yes. Do you need one for a PPO? No. Do I need a referral to see a specialist with an HMO? Yes. Do I need a referral to see a specialist with PPO? No. Do I need to file a health claim with an HMO? No. Only time I would see doing this would be if you ended up outside of your service area and going to an emergency room or something like that. With a PPO, do you need to file a claim? No, not typically, usually only for out-of-network care. And this is because your insurance company has a specific contract with those in-network physicians, and in that contract, when that physician signs that contract and said, yes, I agree to charge these rates for each and every one of these procedure codes, yes, I agree that I will be filing claims on behalf of a member. Remember, if they didn't have that in the contract, you'd be filing all those claims manually. Ugh, I don't know if you've ever filed a medical claim, but it is not fun. So, now, not saying that if you do go out of network, the doctor, the hospital, or the provider's office may file a claim on your behalf. They are doing you a favor. So if they're filing the claim for you, be nice to them. They're doing some extra work for you. So HMO and PPO, again, just some general highlights that I go over in open enrollment meetings. We've gone over this piece pretty much already. The main attributes of an HMO: you pick a primary care physician and you get referrals. The main attributes of a PPO is that you have more flexibility. You can go from one medical group to another. So there are some areas out there that may only have one medical group, maybe an isolated city or location, or only have one hospital, and everyone's fine going to that medical group until maybe they need a knee surgery or something like that. And then they want to go 2 hours down into the bigger city where there's more sports medicine or more experienced, specialized surgeons in that area. That's sometimes where I see people getting frustrated with the HMO because they want to go to a center of excellence for a specific surgery. You can't flip-flop between medical groups like that, especially if they're that far away, because most HMOs have a rule where you have to choose a primary care physician within 30 miles of either your main address, your mailing address, your residential mailing address, or your location for work. One or the other is what you have to choose. You have to choose a primary care physician either close to work or close to your place of residence for employer plans. Usually for individual plans, it's just based off of your where you live. With a PPO, you can stay in your local area for all your regular services, and then when you want that knee surgery, yeah, you can drive the 2.5 hours over to the Center of Excellence and get that surgery that you want. So, again, differences. What is the HMO referral process? You have to go to your primary care physician first. You go to your primary care physician, you may say, oh, I'm getting a rash on my arm and it hasn't gone away. They refer you to a dermatologist, even though logically, most people know if I have an issue with my skin, I can go to a dermatologist. You still have to go to your primary care physician first. Most medical groups will honor that referral for up to 2 years. So if it's a reoccurring issue, you don't have to go every single time to the primary care physician to get that referral. That referral usually lasts either a year or 2 years. And what's the referral process with PPO? There isn't really a referral process. You can just self-refer. And where do I go for looking up providers in my network? There is a website provided by your insurance company where you can do a provider search. I suggest that you get familiar with your insurance company's website, go to the website and register. I believe I went over this in one of my last videos as well extensively to exhaustion on how to go and look that up. I believe it was my EOB video, and I will link that below. And what if my primary care physician is not in my HMO network? If it's not in your HMO network, I'm sorry, if you go to that primary care physician, it's going to be out of network and therefore not covered if you have an HMO. So you're enrolling in an HMO, you need to choose someone as a primary care physician that is in the network. Health Maintenance Organization or HMO, go to your primary care physician first, get a referral. Again, that referral, if it's a regular condition, will be good for the remainder of the year, sometimes even up to 2 years. And for in-network, you can self-refer. All right, so choosing the right plan. So many people may have multiple plans within one family. So the mom may have a condition and she needs really low copays, and everyone else on the family hardly goes to the doctor, so they might be on a high deductible plan or HSA or something like that. So please keep in mind you can mix and match. If you have an employer plan, the employee of that employer does have to be enrolled on that employer plan in order for the spouse and the children to come on. You can't just have the spouse on the husband's employer's plan and not the spouse, or not the main employee. But with the exchange, if you go to healthcare.gov, they will allow you to choose multiple plans for every single person. So you may have, like I said, the mom on a low deductible plan and the rest of the family on a high deductible plan to save costs. And again, insurance companies have formularies. So if you take any prescription drugs, do you take any prescription drugs is what it says here. Be sure to check the formularies. Formularies are so important. It's just a fancy term for medications lists of what medications your insurance company covers. And there will be different tiers. There's tier 1, tier 2, tier 3, and tier 4. And it is important to know which tier your prescription is in and what the copays are for each of those tiers. And there are formulary lists within your insurance company that you can look up. And if you do a PDF, a search within the PDF, you can search key terms. It will tell you exactly which tier your prescription is in. And then for those of you that travel quite often, a PPO may be a better option since PPOs have coverage. Most of them have national coverage, although check your plan because some of them do just have in-state coverage. These just the two main types of plans, the HMO versus the PPO. And here on this table, we do have the EPO, which we talked about briefly, and the POS. If you're interested in knowing about different types of plans, please message me, write a comment. I'm happy to make videos about other types of plans as well, HSAs, FSAs. It's all up to you and your interests and what you need, what information you need. So thank you for hanging out until the end. Hopefully you learned something. Hopefully this video is helping you make a better decision either in your business or as an HR manager, as a CEO, CFO, or head of your family, or the decision maker in your household about insurance. And If you do have any questions, like I said, please message me. If you are an employer and you want to look at alternative options or get a second opinion on your employee benefits, please use the link below to schedule a meeting with me and a free assessment. And thank you for hanging out until the end, and we will see you next time.